Hey, this is Doug Field, and welcome along with my co-host Brent Macy, and welcome back to Healthcare Consumerism Radio. And in this segment, we're going to continue the discussion, Brent, on technology and where technology is playing a very, very innovative role in redefining the way consumers can access care, the way consumers can go about making decisions. And joining us on today's call is Pierce Graham-Jones, Vice President of Business Development for Jiff, which is a venture-backed technology company in California that's looking at reinventing healthcare for employees. Pierce, good morning.
Good morning.
Hey, thanks for getting up bright and early to join us today from the West Coast.
No problem.
Hey, Pierce, give our audience a backgrounder on Jiff and your place in the space.
Sure. So we're a digital health company building customized health and wellness applications for employers. What Jiff is, the thing Jiff is doing a little bit differently is we're really betting on the consumer health IT market, the exploding ecosystem of consumer health apps, devices, and services that listeners of this radio station probably know really well. We believe that employees are going to love those solutions, and in some cases already using a lot of them in their everyday lives. So we tie these consumer health solutions into enterprise health and wellness programs, so employees can compete, earn incentives, and work together or alone towards company-wide health goals. Is
this app driven or?
Each of our solutions is custom built for each of our customers, but they're always apps, and it's always a mobile app and web version of the application.
Pierce, this is Brent. When you guys were kind of looking at the marketplace, when you were building your technology, what did you see in the healthcare system, and how was it changing to really adapt with the digital health revolution?
Well, before Jiff, I was at HHS, and I was working on the High-Tech Act, and I think one of the things I discovered in that experience is just how structurally resistant our healthcare system is to a lot of the innovation that's happening in the consumer space. Mm-hmm. And I think for that employers have some of the cleanest incentives to actually try and leverage this technology and use it to help improve the healthcare system. So that was kind of the starting point for us, is the recognition of the huge amount of innovation that's happening in the on the consumer side of things, and the value and the power that employers have to actually take advantage of this technology.
And that's the path to the consumers, Pierce, that you see, correct, is through the employers who are looking at innovation to really empower their employees, which are the consumers. Is that correct?
That's right. That's right.
Now, Pierce, as you guys were kind of creating Jiff, when you look at the employer segment, what are some of the pain points that you guys were looking to solve for those employers who were looking at, whether it was high cost, whether it was educating the employee population? What were some of the goals you set out to really help them achieve?
Sure. Well, for employers and really for anyone who's trying to manage health at a population level, if you're trying to manage health at a population level, there's really a limited number of clinically valid things that you can do for that whole population, and that's why a lot of these health and wellness programs start with just assess everybody, get everybody to do a biometric, get everybody to do a health risk assessment, and then based on those kind of really a little bit outdated assessment tools, try and channel people into different solutions. And the solutions are kind of built working backwards from that assess everybody model. Mm-hmm. The digital health ecosystem lets you get so much more personalized and granular with the solutions that every individual can use. And so our solution is a little bit more about just getting everybody working on something, mm-hmm. and then going from there.
Now, are you compatible with some of the traditional health and wellness companies out there? I mean, is that a channel partner for you, or do you see that more as competitive?
No, we're compatible.
Okay.
And a lot of our a lot of our customers, of course, are using, have biometrics and HRAs and stuff like that built into their solutions, and we think we can layer in, either on top or alongside those interventions.
That was one of the things. I don't know if you heard the first segment where Ron was talking about kind of technology. I think from a health and wellness standpoint, the traditional health and wellness players are probably looking at your piece of the puzzle pretty aggressively because they're looking to innovate to try to grab a piece and help provide the solution you guys have to their current members that they have and maybe didn't traditionally build this out from their seat originally.
Yeah, and as I said, we do customized solutions for different employers. Some employers, I think one thing we're excited about is solutions that use these consumer apps, devices, and services as their starting point too. Trying to start from scratch with some of our customers and just design solutions around the consumer ecosystem. Something else we're working on.
We've got private exchanges. You obviously come from HHS or aware of the public exchange side of the business. Private exchanges, as you probably know as well, are going to really turn this market upside down. They're anticipated to have 40 million, consumers in them within the next 3 to 4 years. Are you engaged in discussion with private exchanges as potential partners for you?
Well, our big partner is Towers Watson.
That's a pretty good one.
And so we've been going to market with them over the last 6 months, and I think there's a whole bunch of interesting ways that we're going to link up with that we can link up on the exchanges.
Yeah, because the interesting discussion when exchanges first started coming about, and I'm involved with Hero and their think tank, and it's obviously health management runs through the bloodstream here at the Institute, but corporate health is changing, and one of the big concerns by the people in the corporate health industry was the emergence of private exchange. Was that going to disintermediate health management, from the insurance side? And it's quite the opposite, is that, most exchanges don't see themselves sustainable without a very solid health management solution component.
I think in today's world, for sure, and I think there's increasing. I think a lot of insurance companies are investing in lots of different types of digital solutions that are replacing some of their traditional things that they contract for clinically, so there's all sorts of different people that could be providing these digital solutions, and the exchanges are one of the ways that can be the intermediary between the consumer and the solution.
Pierce, when you kind of look at the space, there's a lot of apps out there. Even the healthcare benefit industry has a lot of apps. I mean, there's just a lot of apps in general out there as well. How do you guys make sure that you're the app of choice given all the options that are out there?
Well, so that's what's exciting for us, is that there's so many solutions out there. We don't want to replace. We don't want to be the app of choice in any of what we call our categories. We don't want to be the app of choice in activity tracking. We want all of our partners to win collectively in that space. We don't want to be the app of choice in food tracking. We don't want to be the app of choice in blood pressure management. So we want them. We're kind of cheerleader for the market right now, and excited about the number of companies that are entering each of these different categories and competing and innovating. And our strategy is to integrate with as many of them as possible, especially the ones that are getting a lot of market share, and champion the best solutions. So
is your current model right now to build more and more partners? Is that the direction you guys are taking right now?
That's what our architecture is designed. Yeah, that's what we've been building over the last 3 years, and that's what we think we're really, really good at, is the ability to integrate with many different types of many different types of health and wellness apps, and many different companies in each of our categories. And so that's what we've been building out. And that's something that no employer can really do for themselves. Could never hope to do, really. So we give them and their employees a range of options. In, let's say, activity tracking, each of their employees can all use a different activity. Someone can use a Fitbit, someone can use a Jawbone, someone else can use a Fuel Band, but they can still participate through our app in an employer-specific experience that's custom-built for their culture, to make it fun for their culture, and, looks and feels like their company.
Pierce, if there's a partner listening, a potential partner listening, and or a mid to large employer out there, what's your business model for them? What's your
for what's our business model in general?
Yeah.
Well, we're working for the employer, and they pay us to design these solutions. That's our business model, really.
Okay, so it's not a per employee. It's a design and custom fee. It's not a per employer per month.
It is per employee.
Okay.
And all of the customization and design is built into that per employee fee.
Okay. Got it.
Now, Pierce, if you can kind of look into your crystal ball and kind of, I know the market kind of has some is moving all over the place right now, but where do you kind of see your space, this space in general, next 5 to 7 years down the road?
I think there's two areas. I think that the health and wellness categories keep getting more and more interesting, for lack of a better word. So activity tracking is the most mature right now, and it's doing, and it's fantastic because it's actually getting sustained engagement where no other consumer solutions really have before. But I think that we're going to move into categories that more and more kind of complete the picture of someone's health. So sleep and resilience, and there's a bunch more to come. And then I think also that as more clinically oriented solutions digitize, disease management like Omada, that those can also be offered in the very same way that we're offering wellness solutions now.
So when you were, and I see here on your bio that you were named or recognized by Forbes as one of the 30 under 30 healthcare leaders in the space, and congratulations on that. As you kind of look at Jiff, and what's kind of the 5-year plan for you guys for the employers out there that may be listening?
It's kind of what I said. I think, and if you look at our website, we talk a lot about healthcare, not just wellness. And I think we have big aspirations to apply the same principles that we're applying to the wellness space to broader sectors of the healthcare industry. We
got about a minute left, Pierce, and want to kind of give you an opportunity to kind of wrap this up, kind of leave the audience with one or two takeaways, and then let them know how they can find you guys.
Sure. Well, I just think it's that for employers that are interested in connecting with the digital health ecosystem and that are kind of sick of the status quo, there's kind of a whole emerging trend that lets you actually access consumer solutions and incorporate them into your wellness design. So that's where we're at, and you can reach Jiff on our website, jiff.com, Jiff, not the peanut butter, and there's lots of contact information there too.
All right, Pierce. Hey, really appreciate you joining us on the program today. Have a great Easter weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.